Hello everyone, we are the presenters from University Science Malaysia. Today, we would like to talk about homosexuality and bisexuality, critical information for parents, educators and the general public. These are the members of our group. In this talk, we will cover 6 main sections: introduction, significance, public issues, risk, legal actions, and case study. Before we move into the main content of our presentation, let us briefly introduce you to the important terms that are often used in discussions about gender and sexuality, which is SOGI and LGBTQ. The World Bank used the acronym SOGI and LGBTI or LGBTI+ as shorthand when referring to the issues related to sexual orientation, gender identity, gender expression, and sex characteristics to a full spectrum of people of diverse sexual orientation. In Malaysia, however, this community is often known as LGBTQ community. It is represented as lesbians, gay, bisexual, transgender, and queer. Homosexuality, which is including lesbians and gay and bisexuality, are one of the representation of the gender identity in the diverse sexual orientation globally.
Today, I will talking about homosexuality. Homosexuality refers to a sexual preference where an individual is attracted to people of the same sex or gender. This attraction can show up in different ways, including sexual behavior, romantic feelings, and social identification with a particular sexual orientation. It is shaped by a combination of internal factors like biology and personal feelings, and external factors such as social environment and culture. According to the American Psychological Association, homosexuality is defined as a sexual, romantic, or emotional attraction or activity between members of the same sex. It is sometimes referred to as a same-sex sexual orientation or activity. Next, I will talking about the impact of accepting homosexuality in society, breaking stereotypes and deepening understanding. As society becomes more aware of homosexuality, traditional gender roles and rigid stereotypes are being challenging. This creates a space when everyone can express themselves more freely without being judged. Mental health and well-being. Acceptance of one's sexual orientation has a big impact on mental health. On the other hand, discrimination and homophobia can lead to serious issues like anxiety, depression, and even suicide. Family and relationship. With growing acceptance, LGBTQ individuals can form relationships and families more openly. Legal recognition of same-sex relationships also broadens the definition of family beyond the traditional model. Education and awareness. Acceptance also allows for better educational programs. School and institutions become safer for LGBTQ individuals, reducing prejudice and helping to build understanding among everyone.
Now, I will explain to you about the concept of bisexuality. Bisexuality can be defined as the attraction to more than one gender, to people of both the same and different gender, or the attraction to people regardless of their sex or gender identity. According to the American Psychological Association, APA, bisexual is used to describe person who experience emotional, romantic, or sexual attractions to or engage in romantic or sexual relationship with more than one sex or gender. Now, why do we need to understand bisexuality? So, for the first point is to promote inclusivity and acceptance. Understanding bisexuality encourage social inclusivity by reducing prejudice and discrimination against individuals of diverse sexual orientation. The second point is to advance equality and human rights. Recognizing bisexuality as a valid orientation will support efforts toward equality, dignity, and human rights for all individuals. The third point is to enhance mental and emotional well being. Awareness and acceptance of bisexual identities will contribute to a supportive environment that can improve mental health and self esteem among bisexual individuals. And for the last point is to strengthen interpersonal relationships. Greater understanding will promote open communication, empathy, and respect in relationship among the bisexual individuals.
There are a few risks of bisexuality and homosexuality. For the first one, the bisexuals and homosexuals has higher potentials to depression and anxiety. This is because they will have a persistent erasure of their feelings to fit in order to fit in the monosexious society. They will have a frequent denial of their feelings, of their sexual orientation, the identity uncertainty will be a significant factor to depression, to mental health problems. If they fit the monosexual society, they will have a negative impact on their emotional well-being, because they cannot fulfill their desires. But if they does not fit in the monosexual society, they will have to face a significant discrimination by the society. Both options will create a problem for the homosexuals and bisexuals. Another contributor to mental health problems is that due to the lack of acceptance or support by the family members, the homosexuals or the bisexuals may be excluded by the family members due to the difficulties in finding and affirming spaces. Will increase the feeling of isolateness, the feeling of isolation among the homosexuals and the bisexuals. Next, the bisexuals and the homosexuals also prone to sexual transmitted infection, also called as STI. For the first one, they may be infected to human papillomavirus, also called as HPV, that will increase the risk of cervical cancer in lesbian women. And then next, the remaining infection with genital herpes, gonorrhea, chlamydia will affect both women and men. For the genital herpes, one of the symptoms is it causes painful blisters or ulcers in or around the vagina, penis, or anus. It also can cause stinging pee. Next, as well as gonorrhea, it also causes stinging pee. Or maybe in some cases, the infected patients may not do the urination process at all. And lastly, the chlamydia. It is a bacterial infection found in urethra or testicle or vagina or rectum. Chlamydia as well can cause stinging pee, and it is transmitted by an infected patient. The third risk of bisexuality and homosexuality, there are psychological impacts on their children. If they try to build a family, the child of same-sex family structure tends to suffer from emotional and social problems. They could have problems in adjusting to the family. The signs are observable in their behavior. They tend to appear as more aggressive and antisocial. As a child, being in a motherlessness or fatherlessness family would be an obstacle to the normal development of themselves. This is because both mother and fathers play a distinct role in the development of a child. For the mother would provide an emotional space for her children, while the father would provide a safe space for his children. For example, the children that were deprived in maternal care during their early age, they will naturally tend to find a surrogate mother during their adulthood to fulfill the lack feeling of superficial relationship with a mother. Lastly, the risk of bisexuality and homosexuality. The homosexuals and the bisexuals have to face the legal and social challenges. For the first one, there are legal action towards same-sex sexual relation. The homosexuals and the bisexuals are punishable by imprisonment according to the law in Malaysia. Next, they will have to face the violence and harassment by the societies. They maybe have to face physical and verbal issues such as bullies. Next, they will be barred from blood donation as an advance precaution of HIV spread. And lastly, they will have to face discrimination in employment issues. Thus, they will have the difficulties in fulfilling their psychological, physiological needs, which is then put them at food insecurities and unstable housing.
So, I will explain the main public issues related to homosexuality and bisexuality in Malaysia. We will look at how institutions, cultural values, and social attitudes shape the way these identities are viewed and treated in our society. My explanation will be divided into three key points. The first one is institutional and environmental control. Second, social stigma. And the last one, psychological impact. Under institutional and environmental control, we can see several measures in place. Administrative policies limit public discussion to prevent normalization. Censorship filters content that is seen as morally or socially harmful. And the lack of open spaces reduce the spread of influence among the public. First, we look at administrative policies that limit public discussion to prevent normalizations. Public and state affiliated institutions often implement administrative policies that restrict open discussion about homosexuality and bisexuality. The purpose of these restrictions is to prevent normalization of the behavior in society, especially among students and youth who are still forming identity. These controls appear in the form of limiting gatherings or group discussions, regulating topics in school, and also monitoring public events. Second, censorship filter content that leads to censorship and information control, where educational materials, media content, and public programs that are seen as deviating from moral norms are filtered or removed. This censorship acts as a protective barrier to prevent exposure that may influence behavior or challenge established cultural and religious values. Lastly, lack of open spaces can reduce the spread of influences. This is because institutional non-affirmation and strong public disapproval make a very few safe spaces for individuals to openly express this identity. So, the lack of visible or recognized support spaces can discourage imitation or adoption of these identities in public spaces. Now, let's move to the second main topic of public issues, social stigma. I will focus on three areas. The first one, society generally views these identities negatively. In many communities, homosexuality and bisexuality are often viewed through cultural, religious, and social belief. These beliefs strongly influence how the public sees people with these identities. For that reason, these identities are commonly seen as not normal or not acceptable within the majority of society. Instead of being understood as a natural variation of human identity, they are often treated as something unusual or wrong. The second one is discrimination in family, school, or workplace. Because of negative public views, discrimination often occurs even in places where individuals should feel safe. They may face unequal treatment and lack of support, creating constant pressure to hide and protect themselves just to avoid rejections. And because of that, it can lead to unfair treatment or limited opportunities due to their identity. The last one is hiding identity to avoid judgment. Because of negative perception and discrimination, many individuals end up hiding their identity. They avoid talking about their personal life, showing affection, or using words that could reveal who they are. Some even change the way they speak, dress, or behave just to avoid judgment. But constantly, hiding takes an emotional toll. It leads to stress, loneliness, and confusion because they cannot express a part of themselves that is important to their identity. Now let's take a look at our last issues involve the emotional and psychological impact. There are two main points here, which are internal conflict or stress and family roles and relationships. When a person's internal feelings conflict with their cultural, religious, and family expectation, this creates internal stress. The individual may feel unsure about who they can trust, afraid of being judged, or guilty for disappointing their family. This kind of emotional pressure can lead to anxiety, depressions, or in most severe cases, self-harm or suicidal thoughts. From a psychological point of view, the concern is not simply about the identity itself. The problem arises when a person feels they must hide, fight, or deny their internal experience in order to be accepted. Living in constant fear of judgment can be emotionally exhausting and mentally damaging. This is why parents and educators play a crucial role. Responding with anger, pressure, or humiliation will increase psychological harm, but responding with calmness, firm guidance, and emotional support can reduce confusion and help the individual handle their feelings more safely.
We will start our next segment with the discussion on legal action that is imposed to the homo and bi community as well as all sexual orientation. As you can see, there are 4 elements that is stated to be discussed in this segment. As stated in the slide, in the past, there were no specific legal actions that were imposed and drafted for the sexual orientation of a person. However, as time goes by, modern people start to question their sexual identity, hence increasing the gender identity of a person. For instance, homosexual, bisexual, and etc. The increase of sexual orientation of a person has forced the government globally to take legal actions towards this community, either in a negative or in a positive way. The first element of legal actions that were imposed by the government is criminalization and penalties. In our beloved country, Malaysia, a statement by Samsudin and Ghazali in 2011 issued that sexual practices and gender expressions are deemed immoral, illegal, and punishable by law. That is because Malaysia's people are majorly following Islam practices which forbid same-sex relationship and consider it as a major sin. However, with Malaysia being a diverse country, there are 2 separate laws that are imposed to both Muslim and non-Muslim citizens. The Federal Penal Code for every citizen and Sharia law is for Muslim. You can see that in Federal Penal Code penalties, there are 3 major penalties stated for intercourse, gross indecency, and publications of LGBTQ relating materials. Under Section 377A, B, and D, the person committing such act could be imprisoned for up to 20 years, while publishing such materials under Section 7 of PPPA 1984 could be fined up to 20,000 ringgit Malaysia and imprisoned for 3 years, while those who buy and own those materials could be fined up to 5,000 ringgit Malaysia. For the Sharia law, liwat and musahakah receive the same punishment, which is imprisonment for 3 years and fined up to 5,000 ringgit Malaysia and caning up to 6 strokes, while expressing gender identity could be imprisoned for 1 year and a fine up to 1,000 ringgit Malaysia. As for another country in 2019, ILGA has invoiced a statement that says sexual and gender minorities are often criminalized for who they love, the way they dress, and their gender expressions, which happens around the globe. For instance, the Chinese government in China has issued laws that forbid any online same-sex erotica to be published, hence suppressing the content in various platforms. While in Turkey, the government has stated to be working on a new law regarding punishments towards behavior and attitudes that runs contrary to one's biological sex, called Judicial Legislative Pact. Guatemala and Hungary, however, both enforce punishments to restrict the freedom in expression and promotion form of diverse gender identities. The second element is legal protection and recognitions. As we all know, Malaysia dismissed the recognition of LGBTQ community, thus resulting in no laws created to protect them. However, internationally speaking, there are two big associations that recognize and offer protection for the community: the Yogyakarta Principle and the Office of the United Nations High Commissioner for Human Rights, aka the OHCSR. The third element is inheritance and property rights. Many legal systems do not recognize same-sex marriage, thus preventing partners from being legally considered akin in the events of a partner's death. In Malaysia, no sexual orientation is protected from discrimination, thus resulting to a very limited civil and automatic inheritance rights for partners. Also, Muslims in Malaysia follow inheritance law that are provided by the Sharia law that only allow kin to inherit individuals' property, as well as a certain will to allow inheritance to another non-kin individual. In the West, however, same-sex married couples are said to receive equal rights as married opposite-sex couples. Regarding adoptions, Malaysia allows single individuals to legally adopt in reference to the Adoptions Act of 1952 as a single parent. That being said, the West such as the UK and US allow the community to adopt, as well as the international law, that is the Convention on the Rights of the Child and Yogyakarta Principle. The last element is the implementation of the same-sex marriage. The introduction of the 1996 Defense of Marriage Act, aka DOMA, allows all states to refuse and recognizing same-sex marriage. However, in the modernization of the world, legal same-sex marriage is allowed in 38 countries as of data 2025. For example, the Netherlands, Thailand, Taiwan, South Africa, and many more. Distinct to Malaysia, there is no same-sex marriage is legally recognized.
I will show you some data on sexual orientation identities among LGBTQ individuals in Malaysia. In Malaysia, detailed statistics on sexual orientation are limited due to legal and social restrictions. Therefore, community-based surveys are often used to understand the demographic composition and diversity within the LGBTQ population. The following case example is based on 2024 community survey. Gay and lesbian 55.8%, bisexual and pansexual 30.3%, queer and questioning 7.5%, asexual 4.3%, and heterosexual 2.2%. From this data, we can see that the majority of respondents identify as gay or lesbian, with bisexual and pansexual individuals making up another significant portion. Smaller percentage identify as queer, questioning, asexual, or heterosexual. This figure highlights the diversity within the Malaysian LGBTQ community and shows that sexual identity exists along a broad spectrum rather than fixed categories. On March 12, 2023, people joined the Women's Day March in Kuala Lumpur to demand greater gender equality and recognition of the LGBTQ community. The march included women's rights activists, young youth group, and LGBTQ supporters, all calling for fair treatment and respect for everyone. In conclusion, the case example illustrates that despite legal and social challenges in Malaysia, the LGBTQ community and its allies actively advocate for visibility, equality, and acceptance. The 2024 survey data show a diverse population, with a majority identifying as gay or lesbian, and significant representation of bisexual and other identities. Public events like the Women's Day March reflect the community's effort to raise awareness and push for social change, highlighting the importance of both data and activism in understanding and supporting LGBTQ rights in Malaysia.